Okay, good afternoon, everybody, and welcome to the launch of the Norfolk and Waveney VCSE Assembly. My name is Tony Osmanski. I'm Chair of East Coast Community Healthcare and also Chair of the Norfolk and Waveney VCSE Assembly Steering Group. I'd also like to, before we get underway, introduce other colleagues from the steering group who are present today. You may not see them on camera, but if they are, just give a wave. Alan Hopley, Chief Executive of Voluntary Norfolk, John Clemo, Chief Executive of Community Action Norfolk, Chris Abrahams, Chief Executive of Community Action Suffolk. We've got Lucy Hogg from Voluntary Norfolk, who's the Project Manager for the Assembly. Gary McManus, VCSE Manager from Norfolk County Council. Hopefully I've not missed any colleagues. Apologies if I have. Just some housekeeping. First of all, could everyone please stay on mute when not speaking? Do feel free to keep your cameras on unless you're struggling with broadband, and then you probably want to put your camera off. And do use the chat function. Introduce yourselves to all the other delegates, and you can also pose comments, questions, bearing in mind you're also going to get an opportunity to do that at the breakout. So Tash, if you could put up the next slide, please. Some of today's delegates will have attended one of the engagement events that we held this time last year across Norfolk and Waveney. And at those events, we sought feedback on initial proposals for an assembly. Since then, of course, the world has faced the ongoing challenge of the COVID pandemic and turned our lives upside down. In fact, probably many aspects of our daily lives are on hold, which has really underlined the critical value of the partnerships that we've seen develop between health, local government, and the third sector. And this has been particularly apparent in providing health care and well-being within our communities and to our most vulnerable people. So today we are really pleased to outline the development of the VCSE Assembly to date and our future plans. Now, some elements of the Assembly are fixed, but there's some that still can be shaped. Our experience to date is that this type of venture is a marathon, it's not a sprint. However, with your support and contribution, we are now at the finishing line, ready for the Assembly to fulfill the purpose and principles that the sector requested. Next slide, please, Tash. Well, what a year it's been. When we undertook the engagement last year, there was absolutely no indication that 2020 would be so turbulent. But the results of our engagement session last year was strong support for an assembly. And I think if anything, the COVID pandemic, has proven that is going to be a really welcome feature. Now, in response to the questions posed on the second bullet point of the slide, over 100 representatives said there is a need for an assembly in order to foster inclusion, representation, learning and sharing. The VCSE needs an equal voice alongside the other sectors, health, local government. A memorandum of understanding is required to underpin the overriding principles. It needs to be a joint approach to shared priorities. There needs to be particular focus on the approach to commissioning and outcome delivery. And there was also, ironically, a plea for the Assembly to operate virtually. Well, we've certainly got that wish granted. So now is the time to reconnect with the sector. I hope you will all be able to fully engage today and contribute in the breakout sessions later. And at this point, I'd like to move us forward to our first presentation and hand over to Alan Hopley, Chief Executive of Voluntary Norfolk, and Chris Abrahams, Chief Executive of Community Action Suffolk. Thank you.
Sorry, I'm not hearing anything at the moment.
Some of the best work has been done on mute, I think. So, Alan?
I cannot believe I've done that on mute. I cannot believe after so much criticism of others. Apologies. Right, first slide, please. Now I'm motivated. Right, so we really do have a rich and diverse VCSE ecosystem. I'm not sure ecosystem is the best way to describe it, but I think it goes some way to try to demonstrate what we have in terms of the connectivity by national, place-based, thematic and neighborhood organizations. But the challenge we know we need to do is improve and increase that connectivity, be it a system, be it at a place-based level and a community level, to make sure and we can build on the VCSE capacity to enable this to happen. We really want to improve, as I say, that connectivity, making sure we are working collaboratively, making sure we're doing all those identified aspirations, ambitions that Tony identified at the start. Now, the assembly construct is along the lines of the emerging ICS architecture and will be a mechanism to further embed our connections across at all levels. Thank you. Next slide. So what do we mean by an assembly? Well, we use the term assembly to frame our discussions around a model of how we work together between the NHS, county council, local authorities and VCSE to strengthen our partnership for health and well-being of local communities. Now, whilst elements of the model have yet to be determined and much is still to be developed, we've done that deliberately to make sure that we really do co-produce this across the voluntary sector, VCSE sector, to make sure that everyone feels ownership of, everyone feels embedded in what their plans are going forward. It will need to be open and should be open to all voluntary and community and social enterprises, groups and organisations, large and small, that are delivering health and care and wellbeing services in its widest context, and of course operating across Norfolk and Waveney. Now, its purpose will be to strengthen partnership working and further shared priorities, including a greater focus on prevention and support to the most vulnerable. Increase the influence and participation of VCSE organisations within health and social care, and be right at the heart of the design and delivery of health and wellbeing services in Norfolk and Waveney, to be that equal partner, to be very much embedded in plans and co-production going forward, being a strong and clear voice alongside NHS and social care provision from the local authorities. We are ambitious for the Assembly. We should be ambitious. We've got a right to be ambitious as a voluntary sector. Next slide, please. So in terms of priorities, well, we need to learn, I should say, from the COVID-19 experience, because that brought inequalities very much into stark focus. The greater impact of COVID-19 on deprived areas, BAME communities in particular, have been highlighted, and we need to address these inequalities. So we need to make sure we can better work together in terms of assembly, form and engagement, recognising needs for evolution, making sure that we can work more effectively together. So that co-produced MOU framework to underpin effective and collaborative working, and focus on the 5 core MOU areas. And these are equal partnership, sustainable resource model, digital integration, data sharing and consistent evidence and evaluation. Making sure that we can engage on strategy, developing a joint integrated health and care strategy for VCSE commissioning, focusing, as I say, on a partnership approach between the sectors and across the sectors. So it really has a meaningful and effective partnership between health, social care and the VCSE sector. Thank you. Next slide. So what are the benefits of the Assembly? What are we trying to achieve here? Hopefully we can all recognise and share these ambitions. So we need and want representation of different perspectives and voices, because we really do have a rich and diverse ecosystem. An equal partnership within the integrated care system. and a coordinated focus on prevention and reducing health inequalities that COVID-19 has highlighted and focused so starkly for us all. VCSE representation on all relevant decision-making boards. Our voice and representation needs to be heard at all levels and where decision-making is made. And to foster collaboration to improve standards and innovation across the VCSE sector itself, as well as, of course, with the other partners in terms of NHS and local authorities. And very importantly, building on what works well already. We know so much from experience that knowledge of that we have in our voluntary sector is sometimes not heard. Sometimes we change things to things without actually building on what already works, invest in what works that we know makes a difference to people's lives. And a mechanism for two-way communications. Sometimes I have to say that communications can be one way sometimes, and we need to make sure it's two-way to make it effective for all concerned. And derive the investment in VCSE organisations and local communities that we know is necessary, needed in order to make sure we can innovate, we can develop, we can deliver all the outcomes we want for our communities, for the people we support. So we have that better reflection on locality needs, using the knowledge and experience that the voluntary sector at all levels have in terms of locality needs, making sure that we better reflect them, better make sure they're embedded in our plans and strategy as a collaborative system going forward. Thank you. Now, next slide. So, key features of the Assembly. So, very importantly, a chair with a position on the ICS Partnership Board, appointed and accountable to the VCSE Assembly. Actually,
It's
Chris, I think you're going to carry on this.
Yeah.
I'm so greedy, you say. I'm so passionate about this that actually I want to do more. But you're right, Chris, leave it over to you to do it, I'm sure, better than I can.
Good afternoon, everyone. I'm Chris Abraham, Chief Exec of Community Action Suffolk. So what are going to be the key features of an assembly? And clearly, we're still developing and evolving this, and the conversation today is going to help us do this even more further to the event that we did earlier in November. But clearly a chair and a chair with a position on the STP Partnership Board, soon to become hopefully an ICS board. I think we're due to hear later this year if we're successful. But the board have already committed to that place for the VCSE Assembly Chair, which is really great news. There clearly needs to be some underpinning governance. And again, we've already taken engagement with the sector. This started last October, as Tony says, and again earlier this month. But we recognise that in time, that governance will develop as we get more into a functioning assembly. But it's likely to form a leadership forum or a board structure that can be representative of our sector and our very diverse sector across both Norfolk and Waveney. The Assembly will need to include both thematic and locality working groups that can align to the priorities of the strategy for the STP or the ICS, particularly as we move more to a focus on place, which is a move that we are now making. However, any of those new forums and working groups would likely need to complement and build on the existing fora and structures that we already have and not duplicate the effort that is already working and working well. Another key feature of the Assembly will be to develop effective communications and engagement. This could include digital and online methods, but consideration must be given to ensure that there is the ability to have really good two-way feedback and communications with the diversity that our sector has. That would include those really large charities. It will include social enterprises and those smaller community groups too. The Assembly will have a memorandum of understanding. It's going to be named a shared ambition, or referred to as a shared ambition. And I'm sure some of you have already heard a little bit about that, and John Clemo will talk us through that later. But that's going to set out the high-level partnership, the relationship principles of how we can work together. And this needs to be jointly owned by the Assembly and also collaboratively developed. The Assembly will enable any organisation interested to be part of the Assembly by registering and becoming part of that wider network. And we're going to have a website that's going to be launched in a few days where people can sign up to become part of that Assembly. So next slide, please. So how will it work? So at a really high level, because again, we want your feedback, we want your influence, your help in making some of these decisions about how it's going to work, but lots and lots of different engagement methods that are going to be really effective, an aspiration for it to be as inclusive as it can be, recognising the diversity of the sector. Through the engagement views, views will be fed in to reach common agreement. The board will form and oversee the setting of priorities and will be accountable to the full Assembly. And then finally, the full Assembly will sign off annually the priorities for the coming year. So next slide, and I think I'm handing over at this stage to Lucy.
You are indeed, Chris. Thank you very much for that. I think that was a really, really helpful sort of overview of the Assembly and some of the work that's been done to date. So hi, everyone. I'm Lucy Hogg. I'm Head of Voluntary Sector Infrastructure at Voluntary Norfolk, and I'm the Project Manager for the VCSE Assembly. And what I just wanted to do this afternoon was just talk through a few slides to outline some of the sort of practical next steps in the Assembly development and talk to you about how we'd like to get you involved in this. So next slide, please. So the most immediate next priority is essentially around the chair appointment. So as Chris has said, this is a really exciting opportunity for the sector. So we know that we have the VCSE Assembly represented in the ICS Partnership Board, and anybody who was part of the session with Melanie Craig and James Bullion yesterday will have heard a little bit about how the ICS Partnership Board is developing. And I think what's really interesting is that the board has been kept intentionally quite small to provide that sort of oversight of the ICS sort of executive team. And I think, you know, having a VCSE seat at that table is a huge achievement and a huge opportunity as well for us as a sector. So currently we're working with the STP governance lead to put in place a sort of a fair and transparent recruitment process. So we've done a little bit of engagement with some of the sector leadership groups across Norfolk and Waveney already to get a sense of what, you know, what the sector wants to see in that particular role in terms of the key skills, attributes and talents, but also in terms of some really sort of important issues around some of the exclusion criteria that we might have for the chair. So do we want to ensure that they actually live in Norfolk and Waveney? Should they be employed by a VCSE organisation or be independent? So we're in the process of developing and signing off a candidate pack, and we hope that we'll be going out to recruitment in the very near future. But today is really an opportunity to hear from everyone here today about, you know, what is important to you in that chair role, and I'll talk a little bit more about that in a minute. But also, as Chris has sort of identified, we'll need to put some underpinning governance around the chair so that we can hold the individual accountable to the VCSE sector. At the moment, we've got the steering group in place, and there's been a lot of work done over the past year to get the project to where it is now. But we recognise that that steering group is going to need to evolve into a broader leadership alliance or a broader forum to provide that supportive infrastructure for the chair. And whilst we anticipate initially it probably will take a forum approach. We also recognise that over time that sort of infrastructure will need to probably formalise into more of a board structure to be able to provide the sort of requisite level of governance and support for that chair function. But a lot of this will be dependent on the wider infrastructure that we've got in place within the voluntary sector, within our VCSE infrastructure organisations as well. So around the sector leadership group, what the engagement forum within the STP might look like, and we don't know that yet, and sort of guidance around the ICS chair, which will be coming out in due course. So next slide, please. Oops. You just go back one. So what will the chair do? So their overall duties and responsibilities will be very much to actively participate within the ICS Partnership Board to represent the voice of the sector. So we need somebody who can act as a spokesperson for the Assembly and effectively, inclusively, both hear the voice from the sector, whether that's from grassroots, mutual aid groups, small community groups, right up to national charities, and importantly, represent that voice effectively within that partnership board. So there'll also be somebody who'll be able to, that will need to be able to really drive forward a VCSE work programme linked to the emerging MOU between the VCSE and health and social care sector, and in support of the NHS long-term priorities. So again, I was really interested to hear Melanie's presentation yesterday, and the discussion ably chaired by John Clemo, where we heard that there's going to continue to be a key focus on those three priorities around prevention and tackling inequalities, integration and workforce development. So again, this is an opportunity for the sector to really influence what services are going to look like across Norfolk and Waveney in the future. So again, it's absolutely critical that we get the right person into this chair role. So, and then the other key aspect for the chair will be to support the sustainability and effectiveness of the VCSE Assembly. So we're really just at the starting blocks for the VCSE Assembly. We recognise that this is a big sort of programme of change, and we're going to need somebody who can really effectively develop and lead that case for support and change, and bringing in the necessary resources around it. So it's a big job. Next slide, please. So the next steps in our sort of journey of development over the coming few months to the end of the financial year. So really delighted to be launching the Assembly today. We had hoped that the website would be ready for today, but you never can be sure with technology. So that's going to be going live in a few days, and we'll make sure that we get that out to you via sector newsletters. The Assembly chair identification phase will run to the end of the financial year. But as I said, I'm confident that we'll be able to get that recruitment process out very soon. I think I've covered all my points around that. From the start of the year, we expect the ICS partnership board to be operating in shadow form. I understand that they're looking to meet from around the middle of February. So we do have a small window of opportunity to identify and appoint a chair and get somebody into the partnership board before the sort of ICS board proper goes live in April. Over the beginning of the year, we'll be taking all the feedback from this session and from prior sessions with leaders groups across the system to really start to build up a work plan for the next sort of 12 to 18 months, so that we've got a really clear sense of what we need going forward and the resources that we need to put in around that. Also, early in the new year, we'll be looking to engage with you as a sector around the terms of reference for the Assembly, or that sort of first phase constitution, recognising again that we expect the Assembly to evolve and develop over time, but being really clear on what the Assembly is for that first phase. And also before the end of the financial year, we will be able to share with you some sort of specifications around the Memorandum of Understanding work. So John is going to tell you a little bit more about where we've got to with that later in the session. And I know that there are some engagement workshops planned to involve you in that process. So next slide, please. So what we would like to do next is to move you into breakout groups. We've set up 3 groups, and I think we've got about sort of 35 or so people with us today. So they're going to be sort of fairly large groups, but we are going to be using some technology to support us. So we're going to be using Jamboard, and each group will be supported with a facilitator who will be able to take some notes via the Jamboard and share those with us on the screen, so that hopefully we can have a sort of participative and informed discussion. Next slide, please. So what we would like to do really, and I guess all of this work that we're doing now, it's easy to sort of focus on the sort of the practical mechanisms, but I think we need to do that within the context of those sort of broader, massive changes that are happening across the sector in terms of the impact of COVID on communities, but also very much on our sector, on the funding for our sector, the acceleration of digital strategies. I mean, who thought we'd be running a virtual conference this year, this time last year? But also recognising the huge achievements that have come out over the last 6 to 8 months in terms of much closer working with our statutory partners, and really sort of seeing some movement on agendas that had perhaps been quite stagnant for quite some time. So there's certainly opportunities for us at this time. So what we would like to facilitate a discussion around is really what you as sort of individual VCSE organisations as a sector need in place to enable you to engage and participate in the Assembly. And some of the sort of areas for conversation that we want to focus on are going to be around your expectations of the chair, the role of existing forums and representative structures and how you currently engage in those, the use of technology and digital skills, and how we can ensure that inclusivity and diversity of VCSE voice. So in a moment, Tasha is going to move us into some breakout groups, which are going to be led by Alan, Chris and John with facilitation support. We are actually a little bit ahead of time. So I'm thinking if everyone's in agreement that we will go into the breakout groups for 40 minutes rather than 30 minutes. That will just give us an opportunity to introduce ourselves and just get to know each other a little bit within the groups before coming back to the main room, when we will just have a 5-minute coffee break before going into the MOU session. So that's the plan. The groups have all been set up randomly. So Tasha, without further ado, could you move us into those breakout groups, please?
So welcome back, everyone. For people who don't know me, my name's John Clemo. I'm Chief Exec at Community Action Norfolk. Tasha, can you just show up the next slide, please? And this section's around the bit that Lucy, Chris and Alan, I think all kind of mentioned to a certain extent, but that piece around the MOU, development of a memorandum of understanding, or as I tend to refer to it as the shared ambition initiative. And the only reason for kind of giving it a name like that is when people think about an MOU, they tend to think about a piece of paper that we write. We spend many meetings, committee meetings, coming up with the pros around. We sign it and then we put it on the shelf and never look at it again. And I think this is intended to be something very different than that. The goal is about creating a set of clear agreements with a real practical impact in some real kind of key areas of mutual interest with the voluntary sector, with our adult social kind of care partners, and with our health partners, with that emphasis on practical impact, the emphasis being that this is about something that will be an ongoing process, and that as well as the kind of the the ways of working kind of bits that we might highlight. It will also help try and provide us with a kind of a work plan, a roadmap for some of the activity the Assembly might undertake. You'll see some references in various documents that come out of an Assembly to the Manchester model. And we took a lot of our inspiration from looking at the Manchester model and the MOU that they produced. But we recognise a number of things. That MOU in Manchester was very much the product of a journey, of a lot of dialogue over a good number of years that results in a document rather than a document in itself. We also recognise very strongly that Norfolk is not Manchester in many different kind of ways, and we need something that works for us as a local system. And we also wanted to do something that was informed by our kind of COVID ways of working, that looked at some of the great practice we saw during that first wave of COVID, that saw us kind of make rapid, iterative kind of attempts to kind of improve things, and that seemed as a better way to kind of deliver real meaningful kind of benefits to people, rather than kind of lengthy meetings over the long term where we try and derive a perfect solution before we try and deliver anything. Alongside the Shared Ambition Initiative, and I'll kind of come on to the elements of that, we're also working very, very closely with colleagues in Norfolk County Council and Health around a VCSE commissioning strategy. And it's very much designed that these two kind of pieces of work will work in tandem, recognising the importance of commissioning to many VCSE organisations to get that commissioning relationship right, but recognising also that the commissioning discussion is not the whole of the discussion with the kind of voluntary sector. So in terms of our kind of goals with the Shared Ambition Initiative, I think Lucy said earlier, our goal is to create an initial specification by the 31st of March. And what we kind of mean by that is really to write down and articulate from different perspectives within the voluntary sector and within our health and social care colleagues, what are our kind of key asks in a number of kind of different kind of key areas, so that we can then jointly prioritise those asks. We can agree a way to kind of take them forwards, and that will inform a kind of iterative process of kind of how do we make those asks real, and provide us with a kind of framework for both developing a kind of work program for the Assembly, but also monitoring progress. One of the key things that kind of came out of some of the early engagement was how will this be different? How will it make an impact? Giving us a framework that sort of says, this is what you asked us to achieve, and this is whether or not we've kind of achieved it. Tasha, next slide, please. So we identified 5 key areas for the Shared Ambition Initiative. These were all drawn out of the many and kind of varied pieces of engagement that had taken place over the last few years. We pulled them out together. These seem to be the kind of key themes. And a couple of weeks ago, we tested this with a couple of different groups of VCSE sector leaders, and there was strong support for this. I think we had about 70% say that they were spot on as the key themes, and everyone else said they were nearly right in terms of getting consensus across the breadth of the voluntary sector. That seems to suggest to me that these are the key areas to kind of be focusing on. So we have equal partnership, we have sustainable resourcing model, thinking yes about cash, yes about commissioning, but grant funding, volunteers, skills, digital integration, data sharing, and that consistent evidence and evaluation piece. Tasha, next slide. That's just another slide about making sure absolutely the shared ambition piece sits within the overall kind of assembly piece, but also wants to connect very specifically with the development of a VCSE commissioning strategy. Tasha, next slide, please. So what I wanted to do over the kind of next sort of 10, 15 kind of minutes is just as an opportunity to kind of get another set of kind of feedback from you all into this process. So just to outline how we're kind of doing this, we're putting together a kind of set of design workshops that will take place mid-December. We'll then be kind of sending out some of the output of those design to make sure we can get broad participation and feedback on some of the initial specification things. another set of design work before we kind of try and take a final version out to the sector for kind of consultation, but also agreement through various kind of formal kind of processes. If any of you want to be a part of those design workshops, please do email me or do follow-up contact. We're aiming to kind of do one focused on each of these 5 kind of themes. But what I wanted to do now was just open up the opportunity via chat, and I'll pull up a Jamboard in a second as well, just for the participants here to understand what some of your key asks are around each of these kind of 5 areas. And what I encourage you to be in this is be really specific. Often in these kind of dialogues, we'll talk about things like equal partnership, but we won't necessarily drill down into kind of what that specifically means. If it's about a 3-year contract, say it's about a 3-year contract. If it's about support or agreements around workforce development, say it's about, you know, shared training opportunities. So what I'm going to do is I'm going to share my screen with another Jamboard. I will also post in chat the direct link to the Jamboard, so do feel free to contribute directly, but I'll also open it up for questions and comments in chat, and if anyone wants to kind of speak, whichever you kind of prefer, or stunned silence. Thoughts, comments, your key asks, any questions on the MOU piece? Recognizing some of the names that are on this list, you are unusually quiet. Alistair giggles. Alistair, as a trustee of a number of organisations, what would you say, yeah, are some of your key asks around those areas?
I won't specialise in digital integration and data sharing, but equal partnership and sustainable resource model identifies that there needs to be a longer term, a strategic approach to it, that it's going to be something that we need to be able to sustain over a 3 to 5 year period, and it needs to be resourced appropriately to be consistent with that. To get the benefit, we need to invest. And to invest, we need to be able to demonstrate what we can deliver, what our offer is. So I think that would be my comment, that let's recognise its worth, let's invest in it properly, let's ensure that it is a 3 to 5 year old programme.
Yeah, and I think that longer term horizon, both in terms of the conversation and the funding envelope, is something that's been common to a lot of conversations. And Lucy's put on chat also recognizing, and this is one of the things that came out of some of the learning piece we did around some of the COVID experience, of we need to be able to invest in, you know, core costs, whether that's ICT infrastructure, whether that's staff development and welfare, whether that's physical infrastructure in kind of buildings. And again, as Lucy put, that funding flexibility absolutely kind of key. So Tash, you can just make sure we're kind of capturing those points on the Jamboard. Any other thoughts from anyone? Do feel free to either post it in chat or...
Well, one of the things that Manchester identified was very close links with public health, in terms of both sharing information and the identification of inequalities. And that would be a very sustainable link to have, and to recognise the worth of public health in the widest aspects of housing, culture, art, going back to some of the points that were made earlier in the discussion about the integrated board.
Yeah, I think absolutely, and I think we are talking more both around the sort of health inequalities piece, but also some of the the work that was done with the shielded population around COVID in terms of being able to identify a list of vulnerable people and proactively support them. James Kearns, I guess it's the question to you, what would be the measure, and I know we've talked about this before, that said to you that there was an equal partnership in place? James, have you got any thoughts on that?
I think it's a difficult one, John, as those of us that have been around quite a long while will kind of testify to, really. I think, to me, there are two things. There is partnership, and people's concept of partnership is about kind of working together. And there is equal, that means that actually everybody's view, everybody's contribution is the same. Well, the reality is that's not going to happen, because we aren't equal. We're not equal in size. We're not equal in resources or anything along those lines. So when this is talking about an equal partnership, is this actually saying, we need to be valued as equally as the entire County Council and Social Services Department, the entire NHS? What do we mean by equality in this sense?
I think that's one of the back and forth that's been with the sector. It's a consistent ask. What I would have said is, I guess, two things. I think, one, when I talk to people, it's being about valued as an equal in terms of the knowledge and the expertise of recognizing the scale of individual delivery might be different. What I would say consistently about the scale issue is, the voluntary sector in cash terms in Norfolk is about 350 million in terms of turnover. In terms of impact, by the time you look at the contribution of volunteers, of informal activity, it's huge. And if you look at impact on areas that are a particular key strategic prioritization, so that kind of health inequalities piece, that prevention piece, I would have said it is more significant than some of, perhaps our larger institutional kind of providers in terms of reach and in terms of impact in those specific kind of areas. But I think it's a challenging one, and part of this dialogue is to try and kind of tease it out. Nigel, you made a kind of point about examining duplication within the sector. Is there anything else you sort of like to say to that?
Not really. Just to, I suppose, underline that there's I think a responsibility on the sector, our sector, to try and, where possible, streamline and be more effective. Now, I say that without any detailed knowledge, but I imagine there will be examples of duplication, or perhaps putting it more positively, opportunities for working together, which perhaps need to be encouraged. That's all.
Yeah, no, yeah, I think an interesting area. I think the flip side to that, I'm not making a judgment on this, that people say is duplication also being opportunities for choice. Particularly around service user choice of different kind of models. Alan, you've mentioned about a quality of workforce development. Do you want to elaborate that? And are we equal pay with my local colleagues?
Wouldn't that be wonderful, wouldn't it? But we can certainly start with training. We can certainly start with sharing staff and people, because we got involved a little bit in terms of the workforce development plans, but very much as I wouldn't see anything as tangible difference, because I think, actually, go back to the earlier question, what would equitable partnership actually look like? And I think, like all these things, myself and you, John, we go to these meetings. We had that one in terms of local authority leaders, and they listen and they show some respect and they nod their heads and etc. But what actually happens afterwards? Diddle squat is the most polite words I can use. So when we talk about workforce development, and we've had some engagement there, what difference has it made to our workforce within the voluntary sector? I think the NHS can say they've had some development. It has resulted in X, Y, and Z, but we're not seeing that in the voluntary sector. So it is making sure, as one example, workforce development, how do we ensure that training is delivered equitably? How do we ensure that opportunities are shared more equally? how do we make sure that is a more equitable basis rather than at the present time, which I don't think is really involved or engaged with. Thank you.
Tina, you made a point about diversity and representation at all organisations, and that's a challenge. You know, we talked about yesterday in the health and social care session. Is there anything else you'd kind of like to say to that? Does that look like specific asks in terms of the MOU, or is that something for us as individual organisations to kind of challenge ourselves over?
I actually think it needs to go through at all levels, and by diversity I do mean young people being involved, their voices being heard. They're a large percentage of our population. There's some that are going to suffer the most. They're the poorest generation since the 1600s. So yeah, by diversity I mean it all encompassing at all levels as far as we can have it.
I think that's great, and some great other points being made in the chat. Helen, you talked about wide-scale training accessibility to the VCSE sector. I guess, so my questions would be, what would that training look like, and what would make it accessible to you and your team and your organisation?
We have we do quite a lot of work, and we have a team, and it'd be very good to be able to have safeguarding training, to have mental health first aid, to have access to first aid without having to apply for loads and loads of different grants, because we're all doing voluntary and it takes so much time. And to have, so the kind of things that if I was working in the NHS when I did my peer support training, there's certain things that are accessible on the NHS, and there's some very good training which is already set up. And if we could have access to those kind of training schemes without all of, you know, and it's hard even to find the people who can do the training, and you know, and those kind of things would be really helpful to the things that we're involved in. But it's quite difficult to get access to a lot of those things when you're smaller teams and you're really busy with what you're doing.
So having that kind of core training offer, and we'd probably need to do a little bit of work around scoping what that is, but having it kind of just accessible, free at point of use to smaller organisations, so that you didn't have to fill in forms and apply for stuff, but nevertheless upskill our whole workforce across the system.
Yeah, I think that would be really beneficial to a lot of smaller organisations, and it would also enable, certainly for us, it would enable us to have the things set in place to be able to outreach a lot further into the community and into the things we're doing, because there's obviously all the barriers, we're setting the systems and everything else, whereas the bigger organisations obviously have all that in place, and it, you know, it could actually be quite easy to kind of transfer some of those things and support in different ways.
Absolutely. Any other thoughts or comments? I'm conscious of time and in terms of handing back to kind of Tony to wrap up, or questions. If there's nothing, I will hand back to Tony. What I would say is, if anyone wants to get involved in the detail of the development of any of this, please do drop my email. I'll drop my email in chat. As I said, the timeline for going forward is mid-December. We're holding a kind of series of what will be quite detailed kind of design workshops around each of these areas. That information will be kind of coming back for your kind of input more broadly in the sector. We'll then do some refinement work, but hopefully we kind of get those version 1s ready for the end of the financial year, COVID allowing and our day jobs allowing. But thank you for your input there. That's been really, really helpful. With that, I'll hand back to Tony.
Thank you, John. Just get the slide up. So first of all, just can I thank all of our speakers and facilitators today for the excellent work, and also thanks to you, all of our delegates, for your contributions. You will receive full feedback from the outputs from today, but I just want to go through some of the key messages that seem to be coming out today. If we go next slide, please, Tash. So clearly the issue around collaboration, and we've just heard there, equality as well between health, local government and VCSE. VCSE being an equal partner, absolutely vital. The VCSE are the key representatives and voice of our communities. You know, if we're losing track of what's going on at grassroots level, we really do need to tap into that VCSE resource. Clearly, continuity required for long-term commissioning. The role of the Assembly Chair, the message coming across today needs to represent the whole sector, but there needs to be a reality check in terms of the priorities that individual is going to be either collaborating on or indeed campaigning for at the ICS Partnership Board. The need for strong communication, ongoing co-production in designing processes and delivering outcomes. And also another message coming across that the engagement with the VCSE is meaningful in terms of the content. One of the comments coming out of one of the sessions was that it's not all lost in jargon. We actually cut through some of the ambiguity, the complexity of processes and language and systems, and we simplify things. Commissioning strategy quite clearly required. We also need to recognize that within the sector, we have a huge range of capability. However, we also have a major issue around capacity. So this is not just an excuse to shunt responsibility. So next slide, please, Tash. So in terms of the next steps, first of all, again, thank you for joining us today at the Assembly launch. Really important that the Assembly continues to be a matter of co-production. Please look out for our updates on the appointment of the chair and also our new Assembly website, which will be launching soon, and we'll have details of the chair appointment. Finally, it's premature to send you festive greetings quite yet, even though there's Christmas adverts all over the media. However, I'm sure you're all joining me in looking forward to a much brighter 2021. Thanks, everyone. Goodbye.